How specifically do vaginal laser treatment address concerns like bladder leakage and vaginal atrophy?
Basically improving elasticity and collagen reproduction in the vagina. You get better support of all surrounding structures, which is then the bladder and the rectum. You get improved blood supply, you get improved lubrication, and a lot of ladies even report improved sensation during intercourse.
It sounds like there's a lot to gain from these type of therapies. Hi there, I'm Shanine. As a certified health coach and kinesiologist, I help busy women in their 40s who feel tired, overwhelmed, anxious, frustrated and stuck to live their best years in great health and balance. Together, we'll explore a life that reflects intentional living and lays the foundation for you to live your life's purpose and flourish in your 40s. Welcome to Becoming You at 40. Today's conversation is about something that has been overlooked, under-discussed and often quietly suffered through for far too long. And that is vaginal health in women over 40. Because here's the truth. As our bodies change, especially through our 40s and beyond, so does our vaginal health. And yet so many women are never properly informed about what's happening, what's available to support them, and that they even have options. Instead, many normalize discomfort. They adapt to changes in intimacy. They accept a gradual loss of confidence or connection to their bodies, believing it's just part of aging. But it doesn't have to be. Today we are talking about vaginal therapies, especially vaginal laser treatments, and why this is something more women should know about. Not from a place of fear or fixing something broken, but from a place of understanding, empowerment, and giving women access to choices that can support their comfort, their confidence, and their quality of life. And I'm joined today by Dr. Heidi Siebert, who is helping raise awareness of this important area of women's health. In this episode, we will unpack what's actually happening in the body, how vaginal health changes over time, and how therapies like these can help women feel more like themselves again. Because you deserve to feel at home in your body, you deserve to feel comfortable, confident and cared for at every stage of your life. So Dr. Heidi, welcome to the show. I am very excited to have you here today.
Thank you, Shanine. It's lovely to be here.
I'm also very proud to take hands with Dr. Heidi Siebert and her practice, Reflexion Medispa today, who is sponsoring this episode. With over 30 years of experience as a GP in private practice, Dr. Heidi Siebert combines medical expertise with a holistic, evidence-based approach to health, wellness, and aesthetic care. Reflexion Medispa offers comprehensive GP services alongside advanced aesthetic treatments, including botulinum toxin, dermal fillers, laser treatments, hair restoration, and laser hair removal. Their experienced dermatologist provides a range of personalized face and body therapies designed to enhance confidence and overall well-being. At Reflexion Medispa, their passion is empowering women to look and feel their best at every stage of life, helping them age gracefully while living healthy, vibrant and fulfilling lives. And this is exactly what I want for my listeners. So to each and everyone listening, you are very welcome here. And just before we get started, don't forget to follow the podcast so you never miss an episode, especially if you are navigating changes in your body and want real empowering conversations to support you along the way. Dr. Heidi, at what stage in a woman's life do you typically start seeing these symptoms around vaginal health and bladder leakage?
Yeah, so this will typically start most commonly in my practice after pregnancy, birthing, but more especially from sort of the perimenopausal period. So that is when women go through the change and the estrogen starts becoming less in their bodies. They'll start experiencing symptoms like leaking a bit when they're sneezing or coughing or jumping, not getting to the loo on time. It's not only bladder symptoms, it can be vaginal symptoms as well. Vaginal dryness, lack of lubrication, lack of sort of sensation during intercourse. And then because the rectum is just behind the vagina, it can even be colon and rectum symptoms as well.
Sure. So it's much broader than what we think. Now, what actually happens in the body when women experience this bladder leakage?
So look, it's a multifactorial complex condition. We call it the genitourinary syndrome of menopause, but it is something that actually starts from your early 30s, where you start losing muscle mass every year all over your body. You start getting weakening of the pelvic floor. If you imagine your body almost like, I always say, like a soft drink can, the pelvic floor is the bottom of that can. And weakening, if that bottom is weak, then everything just wants to sort of sag and fall out. The pelvic floor is almost a basket of muscles within the pelvis through which you urinate, and your vagina goes through there, and your rectum at the back. And these three structures all support each other. So it is the weakening of that muscular basket that's important, but not just that. The reason we start seeing symptoms around menopause is the main culprit is the disappearance of your estrogen. So I always say the cornerstone of treatment is firstly to have topical vaginal estrogen. Now that is a thing, some women can't use estrogen for various reasons or don't want to. Especially systemic hormone replacement therapy can be contraindicated, for instance, if you have breast cancer, things like that. So not everybody can, but in general, the topical application of estrogen into the vagina is quite safe, even in cancer patients. So that is always the cornerstone, and the reason for that is that the estrogen is almost like the nutritional substance needed to keep everything healthy down there. Although we apply it intravaginally, it does affect the bladder and the control in the bladder as well. And then, of course, as I say, the rectum as well. So you don't need to put it in the bladder and in the vagina and in the rectum. Putting it intravaginally is usually enough. But in recent years, there have been so many advances and new therapies that have become available. So where for many years that was our only thing we had, that or surgery. Now there are sort of these more, I would call them minimally invasive procedures that are available to women to try.
Now, talking about those technologies, it's actually good news because going through surgery, I've got its own complications. You've got recovery time, and it really feels very invasive. But now, like you mentioned, there are these technologies available. Some of them is the pelvic chair, and then you've also mentioned to me when I came to visit you that there's the vaginal laser therapies. But now there might be women listening to this show that have never heard about a vaginal laser equipment. So can you please tell us what is it and what is it not?
Okay. So the vaginal laser is a CO2 fractionated laser. It's a heat treatment that is transferred through a probe that's placed in the vagina, and that heats up tissue and causes shrinkage. So it's almost like imagining you're putting your steak in the pan and you know what happens to protein. It sort of gets stiffer and so it shrinks a bit. It changes the protein. Because the laser is fractionated, in other words, it's not a diffuse laser, it doesn't burn everything, it burns little dots you've got these bridges of normal tissue in between that then help with healing, so that healing can take place faster and that you obviously still get a very good effect with that. So that procedure is called the FemiLift procedure. It's more commonly known as it, but as I say, it's a CO2 fractionated laser. There are also clinics that offer erbium YAG ablative lasers. And like I say, all of them basically, it works on the basis that you are basically heating up tissue and then you're calling all those cells responsible for healing and regeneration into the area. What would the result of that be? It would be tightening, it would be improved blood supply, it would be improved lubrication and improved sensation. None of the treatments are a once-off treatment. So unlike surgery, it's not a single treatment. It entails usually a session of 3 treatments with 4 to 6 week intervals in between. But what's lovely is there's no downtime in terms of pain or bleeding or even anesthetic. So it is safe even if you were to be considering it if you were 80 years old and you weren't an ideal candidate for surgery. The only restriction is sexual intercourse after the procedure, so you can't have intimacy for 3 days post-procedure. But for the rest, as I say, there's no other side effects. The treatment is only aimed at the vagina itself, so ladies will often refer to their whole genital area as their vagina, which is not anatomically accurate. As you well know, the vulva is on the outside, the labia majora, minora, and then the vagina is the entrance. So this treatment is only suitable for the vaginal vault or the vaginal passage itself. It's not meant for the outside. So as opposed to options that would have been available to patients, let's talk for instance about mainstream medicine, would be something like an AP repair. That means anterior posterior repair, where they cut away a big large part of the anterior and the front and the back of the vagina, and that will then also tighten the vagina and end up giving better bladder control, better colon and rectum control. What it's also not is a bladder lift. So some ladies, in their case, the bladder leakage is so bad that they actually need a procedure that suspends the whole bladder, called a bladder lift. So that is not what this FemiLift entails. FemiLift will give relief for mild to moderate urinary incontinence or bladder leakage. But if it's severe cases, then that still needs to go the mainstream route with surgery. Yes.
All right. How specifically do vaginal laser treatment address concerns like bladder leakage and vaginal atrophy? You've now explained that it's a heat treatment, but how specifically does it then stop that leakage?
Okay, so by basically improving elasticity and collagen reproduction in the vagina, you get better support of all surrounding structures, which is then the bladder and the rectum. You get improved blood supply, you get improved lubrication, and you get improved, a lot of ladies even report improved sensation during intercourse.
It sounds like there's a lot to gain from these type of therapies. How safe is a vaginal laser therapy, though?
So in terms of contraindications for FemiLift, there are hardly any. I think the biggest thing is the modesty aspect of you have to lie there unclothed, you know, almost like when you go and visit your gynecologist. But otherwise, the only contraindications is bleeding. So we cannot perform the procedure while you're actively bleeding or menstruating, and we can't do it if there's active vaginal infection.
So that's important to know, so that they also know when to schedule their appointments. And also for women to know that it's important for them to be truthful to their practitioner and share that information if necessary. Now, you have multiple vaginal treatment therapy products, modern products available in your practice. Can you please tell us what equipment you have available and how do they work differently? And I also know that you do have a pelvic floor chair, so please tell us about that as well.
Yes, I happened to listen to one of your previous podcasts where you featured the Mcella chair. That is a chair that basically exercises the pelvic floor muscle, or the Kegel exercises as they're more commonly known as. And this chair, you literally sit on fully clothed for half an hour and it does the exercises for you. It causes a supraphysiological contraction. So the contraction or the muscle activity is much more than you would be able to generate by just thinking, I'm going to pinch that muscle now.
Yes. Yeah.
So we've got that chair, which some ladies commonly refer to as the throne. Then there is the UltraFem 360, which is quite similar to the vaginal femilift laser in the sense that it also works on tightening, but this can work on the inside and the outside of the vagina.
Okay.
And it works by generating heat once again, that shrinks tissue, that improves blood supply, but it has restrictions in terms of usage. You can't use that if you've got any joint prostheses in place that are metal, or any screws in your body, because of the way the current flows through your body. So there's one place where Femilift can work and you're not allowed to get the UltraFem procedure. On the other hand, UltraFem is cheaper to do, and there's not the sexual intimacy restriction with UltraFem. So with UltraFem, it's basically a lunchtime procedure where you just carry on afterwards as if nothing happened.
Yeah, that's actually amazing to think that someone can get relief.
Technology.
Yeah, without any, well, the invasive part is the uncomfortable part of lying on a bed with your legs open. But more than that, it, like you say, it's a lunchtime activity.
Yes, it's quick.
Quick. So you have mentioned some of the symptoms that it can relieve, but what are realistic expectations that women can have before going into this treatment?
I think you get about a 30 to 40% improvement in tightening in the vagina. So it's obviously not a 300% improvement, but it is significant enough that most people that have done it are very satisfied. The results are with both the Femilift laser and the UltraFem, they're unfortunately not permanent. So after 3 sessions of both those treatments, you generally would sometimes need a top up 2 years later. This is very patient dependent. Like we all heal differently. It would depend on why you came for it, how young you are. So it's very hard to say, make it a hard and fast expectation. If ladies do this when they're younger, for instance post-pregnancy, they talk about the mommy makeovers. You've just had your 3 babies and then you do these procedures almost more preventatively than waiting for the menopause to kick in. The results seem to last long and almost be preventative, as I said.
That's
but
good
unfortunately, news. As you age, as I say, it becomes more difficult to promise everybody the same realistic results.
And I think lifestyle also plays a factor there, because I think if you are fit and you exercise regularly, then the atrophy is probably less than someone that's not really active. So, and I think even just things like how, if you are following a healthy diet and getting enough water, I think all of those things play a role.
Yes, for sure.
Yeah. So who would you recommend this therapy to? Who's your ideal client?
So look, I always say don't fix if it's not broken. So to me, most ladies I help have already had complaints. They're complaining, like I said, of leaking a little bit when coughing or sneezing. They sometimes were never aware that that option was available. Sometimes they come seeking the help specifically because they went and, like most of us do these days, Googled it. But yes, most ladies I would help would be somebody who already has symptoms that they're not happy with.
Okay, and you already mentioned the results and how long the results can last. But what are some of the things that women are sometimes surprised about after this type of therapy?
So I can only speak for my own practice, but like I said, I think what's amazing is how surprised they are with how well it worked. They really are very surprised, and then it is life-changing for them.
Absolutely, yeah.
So, I mean, from a confidence point of view, to be able to do things that you weren't able to do before, it is a big quality of life thing. It's surprising to me that so many ladies are so shy to talk about things like that.
Yeah, that's true.
And that it's still subjects that are quite a little bit taboo, even in today's day and age.
Yeah, it's astonishing, and a lot of women would rather just suffer in silence than actually speak up and say, listen, I have a problem. And I also think a lot of women don't know where to go, where to get help, unless they jump onto Google or are referred, maybe, if they are lucky. Is there any other risks or side effects that women should know before they consider this type of treatments?
Now, like I said before, I think all those three are all relatively safe and only offered by doctors who've had proper training and know how to do it. The problem is that it's not reimbursed by medical aid. So I think that the cost thing is often an issue, where mainstream surgical procedures, although much more invasive, would be reimbursed by the medical aid. This is often seen almost as aesthetic treatments. Hopefully in time it will change, but unfortunately we're not there yet.
How does this vaginal treatments compare with the traditional ways of treating pelvic floor problems, like your pelvic floor therapy and even your hormone therapies?
So look, as I said, it's an adjunct to that. I think the cornerstone is always to do the hormone replacement if possible.
Okay.
Either topically or systemically. I'm a big proponent of systemic hormone replacement therapy for the right lady who's suffering and having symptoms. But that being said, as I said earlier, you can't use hormone replacement therapy with certain breast cancers. There are unfortunately contraindications. And then it is advisable to run it past the gynae or the treating physician whether topical estrogen would be safe.
Okay.
In most cases, the type of estrogen we use vaginally is safe to use even with cancers, and it is only applied twice a week. So it's not a daily application. Like I said, that is the cornerstone to make sure that the nutritional state of the whole genitourinary tract remains in a sort of good space, if you want to call it, like almost like people would say your gut health, your vaginal health.
Yes.
But that is not the only thing that's available. So the laser is definitely an add-on, something that would possibly substitute more aggressive surgical treatments and is an option. It's never just the size of the vagina and how much it's stretched during childbirth. As I said, it's also the pelvic floor. So often combining the treatments by doing the pelvic floor chair and then doing something to improve vaginal rejuvenation is probably the best course of action.
Am I understanding it correctly? Is it almost like giving your vagina a facelift?
I think that's a very good way of describing it.
All right. How does restoring this part of health affect women's self-worth and confidence? What can you share about your patients in this area, maybe?
Yeah, like I mentioned earlier, I think they are so pleasantly surprised by relief of uncomfortable symptoms, how easy the treatment often was to do. And then, yes, like you said, it's sort of something we don't always talk about every day, but that definitely affects a woman's quality of life quite significantly. So yes, overall, great satisfaction and happy clients.
Happy clients, that's what we want. So if anybody that's listening here and they are resonating with what we are saying and they are saying, oh, that's me, I'm the one with those symptoms and I want help and I want to get this therapy, what would you say is her first step?
Yes, I would always say to discuss it with your healthcare provider, whether it be your GP or your gynecologist or your urologist. I would maybe ask about these alternative new therapies because, like I said, it hasn't become mainstream, and that's actually so sad.
Yes, I get you. Yeah, especially because it's got so many benefits. I love what you have just said, that they can ask their doctor about these options, because I think a lot of women go into a doctor's practice. They share their symptoms. The doctor makes maybe a suggestion, but the woman never necessarily question the suggestions or bring her own suggestions to the table. And it's supposed to be a conversation between the woman and the doctor. So I think what you said there, ask your doctor about these options, is extremely important, because at the end of the day, it's your body and you are in charge of your body, and you get to decide which option you would like to take, obviously dependable on whether you are a candidate or not. So I love that. Now, is there anything, if there's only one thing that you would like women to know about their bodies, that you really wish they knew that, what would that be?
Is a very hard question. What I would just say is, whatever your symptoms are, don't suffer in silence. Reach out to somebody. There are so many more options and therapies available. Technology is amazing. We live actually in a wonderful time for women to be alive. Don't keep quiet about it. Talk to somebody.
Yes, absolutely. I love that. Thank you so much. Dr. Heidi, thank you for being here today and for telling us about vaginal laser therapy and for educating us and empowering us with the knowledge that these options are available to us. So thank you so much.
No, thank you, Shanine. Thanks to you, and thanks for all the awareness you are raising out there. It's a wonderful job you're doing.
Oh, thank you. I appreciate that. If anybody listening would like to get hold of you or contact you and maybe take this conversation further with you, how would they be able to reach you?
We have an Instagram page for Reflexion Medispa, and I think that would probably be the way to go.
Okay, perfect. So what I will do, I will just link your Instagram page in the description box, and then people can just follow that to make sure that they get in contact with you. As we come to the end of today's conversation, I hope one thing really lands for you. You are not meant to simply live with discomfort, disconnection, or changes in your body that leave you feeling less like yourself. There are reasons for what you are experiencing. There is support available, and most importantly, you have options. This conversation with Dr. Heidi is such a powerful reminder that taking care of your vaginal health is not something to feel embarrassed about. It's an important part of your overall well-being, your confidence, and your relationship with your body. And if listening to this episode has made you realize that there are areas of your health you've been overlooking, minimizing, or just trying to manage on your own, I want you to know that you don't have to do that anymore. This is exactly the work I do with women. As a health coach and kinesiologist, I support women, especially in their 40s and beyond, to reconnect with their bodies, understand what's changing, and take a holistic, empowered approach to their health. Not just focusing on one symptom, but looking at your body as a whole. Your hormones, your movement, your mindset, your confidence, and how you feel in your own skin. If you are ready to stop guessing, stop settling, and start feeling supported in a way that's personalized to you, I would love to work with you. You can reach out to me through my website at www.dayenucare.co.za, and we can start a conversation about what that support could look like for you. Because you deserve to feel strong, you deserve to feel confident, and you absolutely deserve to feel at home in your body. Thank you very much for joining us for today's conversation, and I'll see you next time. God bless.